Is the risk of myocarditis, that is heart inflammation, increased after mRNA vaccination? Obviously, we all know that there is a risk of myocarditis after mRNA vaccination. But is it more or less, and by how much? What about the risk of myocarditis after COVID-19? Which age and which people are most affected by myocarditis? Let's talk about all these things in details today. Hello my dear friends, I am Poonam and you are watching Biology Explained. A study was conducted which talks about the risk of myocarditis after mRNA vaccination with Pfizer, BioNTech and Moderna. There were more than 192 million persons who received either of the mRNA vaccines from December 2020 to August 2021. There were 1,991 reports of myocarditis. These are from VAERS, that is the Vaccine Adverse Effect Reporting System, where people report about the adverse effects they faced after vaccination. Now, from these 1,991 reports, 1626 reports were confirmed cases of myocarditis. So, we want to look what happened to this 1,626 myocarditis cases after vaccination. But before we look into the data, we have to know that in a population in general, how many people suffer from myocarditis? That is, what is the background rate of myocarditis in a population? And then we have to see what is the total number of cases when vaccine was administered. If it is more than the background, then we can say these cases are due to vaccination. So this is the background case in a population and these are due to vaccination. Now let's look at the table which says reports of myocarditis within 7 days of vaccine administration. The data is for per million doses of vaccine administration. In the extreme right hand side is the expected cases of myocarditis. This expected case data was collected before the pandemic started from 2017 to 2019. On the left side it shows this data is for males and the age is stratified from 12 to 65 years. The first two columns are for Pfizer BioNTech and the second two columns are for Moderna, dose 1 and dose 2. For age 12 to 15 for Pfizer BioNTech, after first dose the number of cases were 1.06 per million doses of Pfizer BioNTech vaccine administration and after second dose it was 70.73 cases per million doses of vaccine administration. So it is obvious that there is a risk of myocarditis which is much higher, that is actually 133 times higher in this age group after second dose. Similarly, for the second age group 16 to 17, after the first dose the number of cases were 7.26 and after second dose it was 105.86. Again it is 79 times higher in case of this age group after the second dose. So it is pretty much clear that in the younger group after the Pfizer BioNTech vaccine, the risk of myocarditis is pretty high. Similarly, if you look at the other age groups, you can calculate yourself for the other age groups. This is for Pfizer BioNTech. Similar results were also found for Moderna. So overall, with mRNA vaccine, there is an increased risk of myocarditis in males. And what about females? Let's look at this part of the table. Similarly, left side shows age, extreme right side shows expected cases of myocarditis, and for 12 to 15 it was 0.49 and 6.35 for first and second dose of Pfizer BioNTech respectively. It is much lesser compared to the males, but the risk is elevated by 37 times after the second dose. Similarly, if we look at the other ages, there is an elevated risk, but in the older population the risk is much lower. So what about the conclusion from these tables? After mRNA vaccination, the risk of myocarditis is higher. We have seen that it is 133 times higher in case of males aged between 12 to 15 after the second dose. Number 2, the risk is higher after second dose compared to the first dose in both sex and ages. Number 3, males are more affected compared to the females. Males comprised of 82% of the myocarditis cases. Number 4, the median age is 21 with 50% of the cases within 16 to 31 years of age. And this table says the reports for within 7 days of vaccination. Let's look at this graph now. The y-axis says reported number of myocarditis cases after vaccine, that is Pfizer BioNTech, on the left and Moderna on the right side. The x-axis says number of days, dark green is for dose 1 and light green is for dose 2. So taller the bar means more cases. If light green part is more, then it means due to dose 2. If dark green part is more, then it means due to dose 1. If we look into both the graphs, you can see that the bars are taller in case of day 1 to 3 and light green part is more. So it means symptom onset occurred within 1 to 3 days after vaccination in both vaccines, and it occurs mostly after the second dose. So does all this data mean we should not take the vaccine? Before we conclude anything, we need to consult with our doctor to understand whether benefits are more than the risk in your case. Moreover, we have to keep in mind that COVID-19 itself causes myocarditis. According to this report, the risk of myocarditis among patients with COVID-19 during March 2020 to January 2021 was nearly 16 times as high as the risk among patients without COVID-19, with the association between COVID-19 and myocarditis being most pronounced among children and older adults. Thus, it is pretty much clear that myocarditis occurs even after COVID-19. So, we have to evaluate and understand the risk-benefit ratio before we conclude anything. According to the author, the major presenting symptoms appear to resolve faster in case of myocarditis after COVID-19 vaccination than in typical viral cases of myocarditis. Even though almost all individuals with cases of myocarditis were hospitalized and clinically monitored, they typically experienced symptomatic recovery after receiving only pain management. In contrast, typical viral cases of myocarditis can have more variable clinical course. For example, up to 6% of typical viral myocarditis cases in adolescents require a heart transplant or a result mortality. However, long-term data for the vaccine-induced myocarditis is not available. For the patients with myocarditis, the American Heart Association and the American College of Cardiology guidelines advise that the patient should be instructed to refrain from competitive sports for 3 to 6 months and should resume after the parameters are within normal range. The study was done with VAERS, so there is a possibility of under and over reporting. Mostly I assume there is a possibility of under reporting. So this can have an effect on the data. Moreover, the cases were calculated as number of cases per million vaccine dose. But remember that vaccines were given to mostly adults during this time frame. So if we look how many doses were given to the younger population, the risk might look more. Other vaccines like viral vector vaccines might be better option for younger generation. However, I am not recommending anything here. Please consult with your doctor and decide what is best for you and your child. Thank you.